My name is Dr. Jackie Eskew, and I am the co-director of the Arizona Pediatric Psychiatry Access Line and also a child and adolescent psychiatrist at the Banner University Medical Center here in Tucson. So excited to share some of the reasons why this resource is so badly needed in Arizona. Mental health disorders are a significant public health problem which affect millions of children and adolescents across the world. Nearly 20% of young people ages 3 to 17 have a mental, emotional, developmental, or behavioral disorder. The prevalence of these disorders has been steadily increasing and rose to a crisis level during the COVID-19 pandemic. The National Youth Risk Behavior Survey in 2021 showed that nearly all of our indicators of poor mental health, including suicidal thoughts and behaviors, have increased for high school students over the last 10 years. Suicide is the second leading cause of death in kids ages 10 through 14, and the third leading cause of death, closely following homicides for youth ages 15 through 24. Concerningly, over half of kids and teens that have a diagnosable mental health condition don't receive the treatment that they really need. More locally, here in Arizona, the Arizona Youth Risk Behavior Survey in 2021 showed us that 4 out of 10 teens rated their mental health as poor. Suicidal thoughts have increased from 19% of teens in 2011 to 24% of teens in 2021. And that same year, over 3,500 teens were hospitalized for suicidal ideation and suicidal behaviors in 2021. Over 50% of Arizona youth ages 12 through 17 who have depression didn't receive any care at all in the last year. As you can imagine, if we don't treat these childhood mental health problems, they can have significant long-term consequences and contribute to the development of chronic mental health disorders in adulthood. But early intervention and treatment can really be effective and improve these outcomes. And this data highlights a really critical issue that Dr. Kalia mentioned, which is our severe shortage of child and adolescent psychiatrists. This is a nationwide issue, but also here in Arizona, the American Academy of Child and Adolescent Psychiatrists has identified Arizona as being in a severe shortage state of child and adolescent psychiatrists. We only have 11 child and adolescent psychiatrists per 100,000 kids in the state, and over 50% of our counties don't have any child and adolescent psychiatrists at all. It's really imperative that we find a way to meet the needs of these kids and teens, and our access line is one way we can help bridge this gap. When primary care docs call our line, they're going to be connected directly to a child and adolescent psychiatrist who can help answer questions that they have about their pediatric patients. These questions can be related to diagnosis, screening, treatment planning, safety planning, and a wide variety of other concerns. And our goal really is to support the frontline providers so that they can feel really confident providing safe and effective mental health care for their patients.